Hi, my name is Hector Briseño, and I will be discussing about the 2009 N1H1 pandemic. In this presentation, I will be discussing the 6 steps of analysis in this specific pandemic. Step 1, gather background information. The N1H1 virus was also known as the swine flu virus, and it was a strain of the influenza virus, which we've discovered in previous years, but this specific one was discovered in early 2009. This virus is said to have emerged from swine, which are pigs or related animals, avians, which are birds, and humans. This virus is transmitted through human-to-human contact. The WHO and CDC declared the swine flu a pandemic in June 2009 and wasn't considered over till August of 2010. There were over 490,000 lab-confirmed cases, with nearly a billion suspected cases and over 18,000 lab-confirmed deaths. Step 2, analyze the present situation. The N1H1 influenza A virus was the cause of a previous pandemic known as the Spanish flu. So in that sense, that should give us the upper hand because we are experienced with a pandemic. We are experienced with a pandemic. However, this virus specifically, which is also known as the PDM09 virus, is different from the known N1H1 virus. One interesting find was that older individuals displayed antibodies to this virus. They assumed that this was perhaps due to exposure earlier in their lives, and this was not the case for younger individuals who were very susceptible to this virus. In our SWOT analysis, some strengths include that, as I mentioned before, we are experienced with this type of pandemic. However, our weaknesses is getting the general public to abide to these new guidelines in order to reduce the spread. This can prove to be troubling because the public does not like to be told what to do. Some opportunities: this will prompt the creation of a new vaccine that we can use in the future, add to the collection of all the many vaccines that we already routinely use. One of the threats is that the fact that this virus is and did rapidly proceed to a global level. This made it extremely difficult to not only control, but to eradicate it completely. Step 3, prioritize core issues. The swine flu, as I mentioned before, was very easy to spread because of its human-to-human transmission. This made it very easy to exceed to a global pandemic. This virus has the ability to cause community-level outbreaks. This means that while it is not big in magnitude, they are very frequent, thus rapidly spreading across the globe. This meant that vaccinations seem to be the most effective way in preventing this disease's spread. Step 4, analysis of alternatives. The biggest way of preventing this disease from spreading was in the form of health guidelines and the development of the vaccines. Though it may not be the best alternative, some people who obtain the virus may choose to rely on fluids and lots of rest only, letting the sickness pass by like a cold. This is because generally healthy people can usually fight this illness alone. Another alternative could be to solely rely on antiviral drugs or over-the-counter medicine to combat the sickness, rather than getting the vaccine or avoiding contact with other people and other health guidelines. Step 5, make recommendations. Encourage the general public to practice quarantine. This could be useful in the spread of the swine flu. While quarantine may not be the most fair or most favorable option, it is definitely one of the most effective. There needs to be dramatic increase of federal funding in all medical facilities. This means that hospitals need to be supplied with the necessary equipment and have the necessary capacity to treat all these patients with a disease of such great magnitude. We cannot have our hospitals crack under the pressure simply because they do not have the room. Step 6, develop an action plan. Since this is a past pandemic, they did develop an action plan. Some of the things they did include travel restrictions in the form of requiring screening tests before entering a flight and requiring their passengers to wear masks throughout the entire flight. Health authorities would constantly remind the public of proper hygiene. This includes stuff like washing your hands often, avoid social gatherings, practice social distancing, etc. On the global level, nations came to agreements that relate to trading and transportation. By October 2009, the first vaccines were already distributed. However, there was a very high demand and only limited availability, which I will touch on in the next slide. So my final opinion: the CDC should not have distributed the vaccines until they had sufficient amounts of it. They did not have large quantities until late November. This led to the public losing trust in the CDC and the WHO organizations. There has to be better communication between the public health officials to ensure that there are no shortages like this ever again. And with that, thank you for taking the time to listen to my presentation. I understand we are all frustrated and tired as we continue into the COVID-19 pandemic, but I believe that our health officials are doing everything in their power to eradicate this disease. They are experienced with pandemics such as the swine flu or N1H1 pandemic, and I trust they know what they are doing. Once again, thank you.